Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome to the Optimal Health Guide, a podcast designed to help you understand your body, reduce your pain, and move toward lasting health. I'm Michael, your host, and with me is physical therapist Josh Vance. He's your guide to optimal health. Josh, so glad to have you here today.
Thanks, Michael.
Hey, Josh, you've got quite a few letters of credentials after your name. Do you mind unpacking those for the audience?
Sure. So PT, I'm a physical therapist. I've been a physical therapist for 25 years. MPT, I have a master's degree in physical therapy. Actually, we were the first class of master's degree where I went to school. Before that,
Nice.
it was a bachelor's degree. And then ECS, I am a board certified specialist in electrophysiology testing. So it stands for board certified electrophysiology. And FMSK, I completed a fellowship in diagnostic musculoskeletal ultrasound. So we utilize musculoskeletal ultrasound in our practice in order to get a deeper look into your body.
Nice. That's awesome. I really appreciate, just kind of hearing a bit of the background and a lot of the areas of specialty that you have. So I'm sure over multiple episodes, people are going to get to hear different components of that and how all of that comes out. Josh, what I'd love to do today is just kind of dig into a few areas that I think, maybe the average listener might be thinking about as they interface with somebody like you who specializes in physical therapy. And so the first area I'd love to deal with is just some common myths that people might have about pain. What are some of the most common things people believe about pain that you find just aren't true?
I think one myth that I frequently hear is that no pain, no gain. No, I'm doing life and I'm having this pain, but that's okay and I can just work through it. That's not really the case in most situations. Pain is there for a reason.
Mm,
And what we want to do is you want to respect that and figure out what is causing the pain so you can adequately handle it and get the pain to go away. It's not something that you should just necessarily live with. There are a few conditions where no pain, no gain. If we're talking about a frozen shoulder, you're going to have pain in the process of improving. But for the vast majority of different issues, if it's pain and it's not soreness, and there is a difference between the two, soreness is a normal physiological response to exercise when you haven't done it. But pain is something else, and there's something going on, and it's important to figure out what is the cause of that pain and then directly handle.
that's good. You kind of already hit on my second question to some degree. Why do you think so many people assume that like pain is just something that you can just live with? Like it's there, I'm just going to kind of plow through it.
I think there's a couple reasons. I think one reason is that people are busy and they don't want to take time to go out and get the help. I think another common reason is they'll either assume it'll go away after a little bit of time, and sometimes it does, but also fear. People oftentimes are afraid of getting a diagnosis of something. And so they would rather just kind of stick their head in the sand and not know what's really going on when the majority of the time it's often very simple and can be readily handled and relieved and they can get back to their life without having to have that mental worry that this is something that's really bad. I've seen that
Yeah.
plenty of times.
Well, you've identified a couple myths people have about their pain, both that, no pain, no gain, and the idea that I just need to live with it. Do you find that kind of believing that way, thinking that same way can get in the way and interfere with somebody's recovery, making it even more difficult?
Yes, I mean, I think one thing is they don't seek treatment, and then the other thing is if they are in treatment, sometimes they have that idea, well, it's okay to hurt while we're doing, X exercise or whatever kind of treatment. And so we have to really educate them to help change their mindset
It's
so that
good.
they understand that we don't want pain. If we have pain doing something, we're not doing it correct. There may be a movement pattern that's not normal that we have to refine, or we may have to change something that's going on so that
Hmm.
they can move and do exercises in a controlled fashion that's not painful. And that will then allow them to help get better.
Why do you think that people will wait months or even years before coming to a physical therapist?
Well, I think probably the biggest reason I hear is I figured it would go away. 3, 4, 5 months, 6 months later, it's still there. Well, okay, maybe I need to do something. So then, they may go and get a referral to therapy, and that process may take some time, sometimes depending on different factors, and sometimes they just don't want to have to take the time. I have noticed that guys are worse at going and getting help than the ladies. The ladies
Yeah.
are much more willing to go get help than the guys. The guys, they just they stick in their head, no pain, no gain, and I'm just gonna plow through it, and I'm just supposed to be in pain, maybe for the
Yeah.
rest of my life. Complete fallacy. Shouldn't be that way.
I feel like you've been listening into conversations my wife has been having. And so, yeah, I totally see the differences in how we play that out as well. So, what is it that usually has to happen in someone's life before they finally say, okay, I need some help?
I think one thing is the pain just has to get so bad. And maybe that pain is I can't go to work. Maybe that pain is I can't get out of bed, or I can't go play golf, or physically the pain's too much. I can't
Yeah.
endure it anymore. I can't take the pain medication anymore. I don't want to take pain medication. There's just a lot of things, but kind of the pain of the pain has to be bad enough to, okay, I'm willing
Yeah.
to stop. I'm willing to go get some help. And so now I'm going to go do something to get that handled.
Yeah. You're kind of hitting on this already too, but I'd imagine, so correct this if this is wrong. I'd imagine delaying going in actually leads to a longer recovery process.
And the majority of the time, yeah, because the longer we have a problem, our body begins to compensate and do other things. So, example, we have pain in our back. Okay. So, we can't do certain movements. So, we compensate. We learn to move differently. That then causes other muscular dysfunction in other
Yeah.
muscles. That then can perpetuate the pain and cause other painful areas. And then over time, we can get some weakness starting if we put it off long enough, because pain causes muscle inhibition, and so we're not firing all the muscles. We have to retrain the muscles from a treatment perspective. But when those muscles haven't been exercised, they're going to gradually start getting weaker over time. So, if we put this off 3 months, 6 months, we can start to get muscle atrophy or weakness. And so that's just going to slow that process down. Whereas if we, initially had pain, we got in there, we got some treatment, it's going to be a lot easier to get those muscles to respond, because they're going to
Yeah.
remember quicker, and they're not going to be as weak to begin with. Other issues don't tend to crop up as much too,
Yeah.
that may have happened because of compensatory changes in the body.
Yeah. That's good. All right. Well, I want to move into the final segment that I want to discuss with you today. Just the idea of like how Vance Physical Therapy approaches optimal health, even from a philosophical standpoint. And so the first question would be, when Vance talks about bringing and offering optimal health to the whole valley, wanting to guide the whole entire valley toward optimal health, what do you mean by that? Or what do you think you, as the leader of Vance, want to see embodied through that type of imagery?
I want to see people living to their maximum potential, not living in pain, being able to do what they want to do, being able to exercise, being able to have great nutrition, understanding disease from a perspective of things that cause disease. Bad nutrition. Well, there's a lot of different. I'm going to call it perspectives. A lot of different opinions on what good nutrition and bad nutrition is. But there's also plenty of evidence-based science that really dictates what truly is good nutrition. From a holistic perspective, our bodies, we're not just like a knee, in the sense of I come in for knee pain. Okay, yes, there's a knee issue perhaps, but, how are we doing when we're exercising? How are we doing sleeping? How are we doing walking? How all those other parts of life that knee pain or back pain, for instance, can affect. Back pain can affect a lot of different things, not just how we walk, being able to get out of bed, being able to do our jobs, being able to interact and have a social life with family and friends. So I want to see people being able to live their ideal lives and doing all the things that they want to do, and empower them to do it in a
That's good.
healthy lifestyle without pain, utilizing technology that we have to
Yeah.
help them just thrive.
That's good. That's beautiful vision. That's really good. How is the approach you take different from a traditional physical therapy model that people might already have in their head or even have already experienced somewhere else?
I think we have a couple things. One thing is our approach is a hands on. manual therapy approach. So we spend a fair amount of time with just about every single patient doing some sort of manual therapy technique. And I've found over the years it to be highly effective and in many cases more effective than doing non-based manual therapy treatments for the same condition. So that's one way. Another way is using our diagnostic ultrasound so that we can laser focus what's going on. If I have a person that comes in with shoulder pain, well, gosh, there's a lot of things that can cause shoulder pain. So we can utilize that. We can look in the shoulder. We can look at the structure. We can look at the ligaments, the tendons, the bursa, the
Mm,
muscles, just so many different things. We can see bone to some degree. And so that really helps to guide what we're trying to treat. So we have a laser focus and we're not kind of doing a more of what I would call a shotgun approach,
yeah,
trying bunches of different things, but we know for sure, this is a problem.
that's
That
really
coupled
good.
with the electrodiagnostic testing of nerve EMGs and nerve conduction studies, if a person has some sort of burning or tingling or numbness, we don't have to guess where it's coming from because we can do a test and know specifically what is involved. If there is a nerve injury, we can locate exactly where it is. We can know how bad it is. We can know what part of the nerve's involved. So
Yeah.
it's just really laser focused to be able to help understand a condition and handle it faster and more precise.
That's really good. That's so helpful to think that you can zero in, and instead of just trying to figure out, hopefully this will work, that you really can figure out what's going on. That's quite amazing. Well, last question from me, and then I'm going to hand it over to you. But why is it important for patients to think of you not just as a therapist, but as really part of their long-term support team?
Well, as physical therapists, we're trained in a lot of different body systems. And so we really can be relied on to be the primary musculoskeletal clinician. If you have a musculoskeletal problem, neuromusculoskeletal issue, coming directly to us saves time, it saves resources, it saves headaches because we can just directly get into your issue and help you. And that's what we specialize in.
That's great. Josh, any other closing thought you want to wrap up this conversation with that you think listeners would be blessed to hear?
Well, I just think, if you have pain, really consider what's going on and don't wait. Get some help. If it's persisting, if it's causing problems and you've tried some things and it's not working, get in and get some help. Don't waste time. It'll be faster if you get it done sooner. The majority of the time, it's a simple thing to handle and it won't take a lot of, it won't be terribly inconvenient. And you're
Mhm.
just going to have a much better quality of life. You don't have to be thinking in the background, oh, I hurt doing this. I can't do this,
Yeah.
and I can't do that, but I want to be able to do this and, live life to the fullest. So take advantage of getting the help that you can.
Awesome. Well, Josh, thanks so much for sharing with us. Thanks for having such a compelling vision that drives back behind what you're doing. And thanks so much for being the optimal health guide. Take care,
Absolutely.
everybody.